Vequist. He's going to talk to us about free markets in health, very important issue, evidence of better outcomes. David G. Vequist V, PhD, is the founder and director of the Center for Medical Tourism Research, the very first academic research center devoted to medical tourism research, medicaltourismresearch.org. He is also a tenured full professor of management in the HEB School of Business and Administration at the University of Incarnate Word in San Antonio, Texas, USA. His center has held several medical tourism research conferences around the world and has consulted with companies, countries, and NGOs. He's an accomplished speaker, author, researcher, and futurist on the topic of healthcare trends, medical and retirement tourism, health, technologies, social media, analytics, training, development, leadership, and technology management. He has presented on 5 continents, consulted with Fortune 500 corporations, NGOs like the United Nations, and has also produced numerous articles, papers, and book chapters, as well as being interviewed in many publications. Please welcome Mr. David Vequist.
Thank you. Thank you, sir. I'll take the mic if you don't mind. All right, so give me a second to get this back to the beginning. Sorry, I just noticed it was at the end. So let's go back here. Oh, sorry, it's off the screen. There we go. There you go. There we go. Now we'll be on the beginning. There we go. All right, so we're at the beginning of the slide. So I apologize. In order to get everyone out at a decent time for the break, I'll try to go through some of these quickly, but also leave some time for questions, and also be available during the break for questions if you'd like to ask. So we're going to be going over some general trends about medical tourism, and then eventually what we'll make our way into is basically disproving several myths that you've heard about healthcare, and then ultimately getting down into some specific data that has fairly recently been made available about Colombian medical tourism. So I'll make sure and give you something that you haven't seen before and that very few people in the world know about. So, so first of all, let's talk about a little bit of what we're going to go over. Again, basics, some examples. Got some really cool stories I'm going to tell you about, some fascinating stories that show how messy and complex and amazing free markets are in healthcare. And we're going to talk about what the advantages of free market healthcare are, and why there's a lot of myths around it, particularly the myth that you can't get good healthcare unless the government gets involved. Then we're going to also talk about, again, Colombian specific medical tourism, and give you some advice on how to take advantage of this amazing, incredible trend of free markets throughout the world. So again, you heard a little bit about the center. The most recent news is that we've just been moved, my center has been moved into something called the Institute of the Americas, which is thanks to a multi-million-dollar gift to my university, which is a large Catholic university in San Antonio. So it's great because now I have resources available for research and graduate assistantships and integration throughout the school, including our medical school and a variety of other programs. So that's fantastic news. They also made me a part-time researcher, which means basically I get to do everything I was doing before, but I get to work less. So, which is kind of nice too. And I get paid the same too, which is great. So again, about me, I'm a former both consultant with Ernst & Young, Big 4 consultant, Big 5, depending what time frame you know of. Also was a executive with HCA and oversaw one of their largest subsidiaries, in fact, their largest subsidiary in the United States, a multi-billion-dollar healthcare system in San Antonio, and then dropped out and joined academia, which is the greatest job in the world. Young people, if you're not looking at your phone, you're going to get some good advice. You ready? Don't get a job as anything else other than a professor, a influencer, Instagram influencer, YouTube, star, or maybe rap rock star, or let's see, what else would that be? Professional athlete, because those are pretty much the easiest jobs in the world. I work like maybe 20, 30 hours a week, get to travel the world. It's a great job, and they pay me a lot of money, so it's weird. So anyways, professor, remember that, professor. You just got to go get that PhD thing. All right, so medical tourism in general is a really cool area. It's basically the modern equivalent of it is a growth of technology, essentially spreading ideas and models and information, particularly marketing information about the international alternatives to healthcare. As you're probably aware, healthcare for many centuries has been thought of as primarily local, but obviously through technology and through transportation improvements and things of that nature, we have this wonderful ability to take advantage of globalization in healthcare, and it's been happening for many years. It's kind of a hidden trend that most people are not aware of. It's also mixed with consumerization. Again, when you have more information available through the interweb, and you also have more options that you can go to because of increased transportation and technology, then you're going to take advantage of that. So what we're seeing is increasing consumerization in healthcare, which is great. It's great for everybody. All right, so let's go into some basics. I'm going to give you a quick tour. It's definitely going to not be a dissertation or a PhD class. It's going to be a bachelor's level class, but we're going to go through it quickly. So basic definition, I include all of healthcare consumerism. So there's some really cool areas. I'll talk about a few of them, but there's things, for example, like people flying to Switzerland for deaf tourism, doctor-assisted suicide. There's people that travel around the world for surrogacy tourism so that they can have children through a surrogate abroad. There's people that travel for obviously things that you would think of like cosmetic surgery. There's people that travel for cardiac procedures. There's also people that travel for example, down in Peru, some of you are aware, and some of you may have taken advantage of it, hallucinogenic drugs and things of that nature. That's a form of medical tourism because it's actually used in some cases for mental health issues. So a lot of different subcategories. We're going to touch on a few of those. It's very, very old. So there are ancient texts that refer to, for example, Romans traveling to what's known as Switzerland and Turkey now for balneotherapy or for hot springs therapy. The story, and if you've been to these events, I might have told this story before, I apologize. For those of you who hadn't heard it before, you'll love it, is that the Romans actually started using mud baths after having come back from fighting the Gauls in Central Europe. And as they were coming back through northern Italy and the volcanic regions, they would take the volcanic mud and they would stick it on the horses' wounds that they had received. And those wounds, they noted, not really perfect empiricism, but they noted that the wounds tended to heal better from these chemical-induced muds. And so that's why if you go to Italy today, there's all these spas that Europeans take advantage of where they do mud baths with volcanic mud, and that's actually where the history of that came from. And when I was telling the story with a group the other night about in Egypt, there's a formulary on the wall in the temples, and people used to travel to Egypt to get access to various different procedures and treatments, if you will. So it's really fascinating. And again, it's been primarily spread by the internet and cell phone usage. I'll talk about that here in just a little bit with an interesting statistic. And again, consumerism is, I think, a good thing because it's ultimately choice. And by the way, this is regardless of whether there are government entities or not, because what we find is consumerism, particularly in things like healthcare choice, it comes about whether there's a government or not. There's always going to be black markets, gray markets, and these traditional free markets. Okay? This has led to what we consider now to be potentially a $50+ billion industry in medical tourism, very difficult to monitor. In fact, a lot of this, as I found out when I was in the Dominican Republic just a few months ago, is not reported because of tax purposes. So the Dominican Republic, the cosmetic surgeons have jokingly put, when asked by the country how many plastic surgery patients come every year, they always say 20,000. And they've been saying that for years over year. And so I looked at some data that showed that it looked like a lot more people were coming than 20,000, and said, I think some of you aren't reporting your money to the, because it's cash payer, to the government. And this huge roar of laughter went up through the entire thing, because they were all like, yeah, okay, you got us. But anyways, and then wellness as well, which there's an organization that puts out some wellness numbers, but the numbers are huge because they include like spas and hotels and things like that. So the wellness tourism piece of it is easily billions of dollars. The Wellness Institute suggest it could be upwards of 3 trillion. I think that's probably a little high. So some great examples of consumerism. I won't mention all of them, but I just want to bring up a few, is some things that you'll hear about later in terms of anti-aging and longevity, and in some areas they call things like super health. The idea of that there's now people that give health advice and have blogs, and there's groups of people that talk together. One of my former graduate students actually got a hip replacement surgery, and he determined which procedure, what types of equipment to use, and which surgeon to use based on a site called Surface Hippie, which is a group of people that get together that are either going to have or have had hip resurfacing or hip replacement surgeries, and they get together and talk. Google searches, about 1 in 20 of all Google searches are healthcare related. It's one of their largest categories, of single categories. We're seeing the integration holistic in terms of food, beverage, nutrition. Employee health has become very important because of things like mental health issues. All these things are coming about because consumers are driving it. It's not being driven by governments. It's not being driven by trade unions. It's being driven by consumers. Interestingly, it's not for everyone. When we look at most surveys, only about 20% of people seem to be interested in going out of region for healthcare. In a Gallup survey back in 2010, they actually found that about 20% of all Asians travel within the country at the very least, because, for example, if you're in China, you know, in the western part of China, you really only have the government facilities, and they're horrible. And so they travel to the East Coast to go to the larger cities in order to get access to good care. So travel's not for everyone, but we do find that a portion of the population is always going to be interested in it. Some reasons why, let's go with the stuff on the bottom first. Some reasons why the most common reason we typically find is not necessarily what you would consider price versus quality. Michael Porter, in a book called Redefining Healthcare, Michael Porter from Harvard Business School, suggested that actually most of our conversations about healthcare should be about, you ready for this, value. In other words, you're not going to get the cheapest healthcare, right? Hopefully, that's not good. And you know, you can go to a back alley somewhere and get cheap healthcare, but that's probably not what you're interested in. And you're not always going to look for the greatest quality because of the price for the highest quality, and you may have to go very far for that. So Michael Porter suggests those two things are linked together. It should be healthcare value, not price, not quality, but value is what most people look for. And the other thing is accessibility. If you don't have access to something, you're more likely to look for something. It makes sense. So if something's not available in your home country, people will typically travel for that. So let's talk about some stories. I'm going to go through these very quickly. So one of the stories that you probably are all very familiar with if you're here in Colombia, because you're familiar with the country next door and the former leader of that country, Hugo Chavez, who used to travel to Cuba for his oncology treatments. You may have heard a really fascinating story, interesting one, shows how messy patient consumerism and patient choice is. A couple from Australia decided to do surrogacy tourism in Thailand, and when you're implanting the babies, the embryos, oftentimes you'll have multiple implants because you end up with failures. So therefore, this surrogate ended up having 2 viable babies that she birthed. The couple came from Australia to pick up the babies. They found out that one of them had Downs, and so they decided to grab the child that did not have Downs. They rushed to the airport, flew back to Australia. and they left the Down's child in Thailand. And so the woman from, the surrogate from Thailand actually ended up applying for Australian benefits and became an Australian citizen because she had access to the child, and they made a special decision in favor of her for that. Really fascinating. Anybody remember the song? Even young people. There you go. What does Gangnam mean, by the way? Didn't we have somebody here from Korea? It means south of the river. South of the river. What's special about Gangnam and south of the river? It's a nice area, right? Huh? A lot of cosmetic surgery places. You guys know what K-pop is? Come on, young people. If you don't know what K-pop is, you are not hip, right? All right, am I right? Okay, so you may not also be aware, not only K-pop, but also the Korean soap operas are extremely popular throughout Asia, and the people in them are hot, right? Am I right? They're really hot, but they all look the same. And the reason is because they, and I'm not saying that in a bad way, so they all look the same because they use templates. They actually take people from China, for example, fly into Korea, go to Gangnam, and they take a picture of their favorite K-pop, and they say, I want to look like this. And so there's a template that they use, and they actually, they almost like factories, in cosmetic factories. So really popular in Korea. So you may not have heard about this. This is really fascinating. So many African nations have actually put it on their constitution now that presidents cannot leave the country for health care. So this is the former president of Nigeria, who traveled to London for oncology care. And many, obviously, Africans in particularly sub-Saharan Africa, they think this is horrible because what happens is money and expertise, if you will, go outside of Africa because people don't pay for expensive invasive procedures in their country. This is a very fascinating case that just happened in the United States. You're probably aware that with migration into the United States, particularly across the southern border, we have a lot of what has been characterized as, what's the term, anchor babies, which is people that will give birth in the United States in order to get dual citizenship, so that they can have, they have a place to go if they would like to travel to the United States and get citizenship. Well, this has been going on for as long as I'm aware of, but we had a group of Chinese citizens that were connected to government officials, communist officials, high level, came into the United States. They booked an entire apartment complex. The women were staying in the apartment complex, going to give birth in the United States when they were raided by the FBI. And the FBI decided that somehow this was an illegal act. I still don't understand exactly. It was the people that were had planned it, had apparently lied about the various visa requirements for coming in or whatever. So the FBI raided it, and one of the interesting things they found, you guys will find this funny. So you're a Chinese pregnant woman, you come to the United States, what's one of the first things you want to do? Come on, you're supposed to say Disney World, but that's not it, right? Okay, you know what they did? They went to a gun range. They actually took all these, so there's a bunch of pregnant Chinese women at a gun range shooting downrange, so it was pretty fascinating. So this is one of the, so this was relayed to me by a professor from Yale who studies fertility tourism. This is one of the most fascinating stories in the world, and you're probably not aware of it, which is there was a fatwa that was issued by the Khomeini from Iran many years ago about homosexuals, which is that if you are a homosexual, you would be stoned to death, which, as I recall, is the Sharia law punishment for homosexuality, unless you transitioned your gender. So many years ago, the Iranian physicians, the surgeons that do these gender reassignment surgeries, became very proficient because basically everybody in the country had a choice. Well, is that really a choice? It's either death or change your gender. And so they are some of the most proficient surgeons in the world, and people travel from all over the world. Homosexuals travel from all over the world to go to Iran to get surgeries for gender reassignment. Isn't that fascinating? So this is a Canadian, was it premier? I think it's called a premier from Newfoundland that many years ago had decided that he wanted to get a cardiac procedure at a good hospital. and he decided that there wasn't really a good one in Canada, so he went to Florida. He came back, the press was lambasting him and saying, "Why did you go to Canada?" And he said, "My body, my health, my choice." So India received so many visitors, particularly from Africa, that they had assigned a medical tourism visa. They have a special process for going through the customs line, so make it easier for these folks to get in and do medical tourism. In the United States, one of them, probably one of the most fascinating trends is that people that work at Walmart that are getting nearly, say, minimum wage, actually it's much higher now, but let's say they're getting $11 an hour and they're working at Walmart, have access to some of the best facilities in the world. Walmart gets a bundled contract with like the Mayo Clinic and Cleveland Clinic and places like this. And what they do is they negotiate a lower rate, a volume-based rate, free markets, right? Volume-based rate with these, and a Walmart employee who's making $11 an hour needs a heart surgery. Walmart calls up the best physician potentially on the planet, and the surgeon says, "Hey, by the way, here's one of our employees. We're going to send him to you, and we're going to pay for the airfare. We're going to pay for the hotel. We're going to give them a per diem. They get to take a loved one with them. They pay nothing out of pocket. We'll take care of everything." And Walmart, according to some data that was released by the consulting firm that worked with them, saves upwards of $40,000 per employee. These coverages are available for 1 million employees in the United States. So 1 million Walmart employees have better health care than almost everybody on the planet. Isn't that amazing? Welcome to free markets and healthcare. It's cool stuff. The government of Korea is particularly fond of their private facilities. There are a couple of public facilities, but mostly this is all driven by private facilities. So they said, you know what, we believe in our doctors, we believe in our facilities so much that if you ever have a problem, we will give you a warranty. And they basically will say, if you're not satisfied with your procedure, come back and we'll get it work done or you'll get your money back. Isn't that amazing for any international tourist that goes to Korea? So a NHS doctor who is an oncologist, as I recall, had basically kept records of his patients that were international patients that had come to the UK for surgeries and for procedures. And he thought it was about 1 out of every 20 patients that he was seeing. There's an old African saying that London is a good place to die. And so Africans, if they don't have any other recourse, will oftentimes fly to London. They'll present at an NHS hospital and say, all right, treat me. So this physician had suggested that about £2 billion a year were spent on international visitors coming in that were not paying taxes. This is an amazing model. I was talking about this at the dinner last night, as I recall, which is modeled where a nonprofit Indian hospital, what they do is about 60% of the people that present to them, this is something you want to clap about too, you love this, 60% get health care for free, 40% pay. The only difference is the waiting room. The waiting room for the 60% of the indigent care, the people that don't have to pay, is just a big open area with benches, and it's got a cafeteria where you get, you know, lousy Sodexo food or whatever, like a university or a cafeteria. But if you go into the good area, you get nice seating and you get a nicer food that you can order from. The people pay for it because it's some of the best surgeons on the planet for eye surgeries. In fact, it's suggested that because of the number of surgeries that they do, it's like a factory. These are some of the most experienced eye surgeons on the planet. And so they operate the entire organization at about a 50% margin. So they make money and 60% of the people pay nothing. Free markets. Welcome to it. All right, so what's going on with free markets? Well, it turns out there's a lot of people that want to say to you that government needs to be involved because otherwise there's not going to be equity. People aren't going to be able to get the health care they need, right? You hear this all the time. You can hear it in every country of the world. Without government, how are we going to get health care? And also those people want choices, right? But they just want you to pay for their choices. All right, so what have we found? Well, the data is pretty clear. Private facilities are better. Even in places like India, where people have access to basic public health care, every person in India, turns out when they're giving birth, nobody goes to the public facilities. Turns out that 63% of them, and these are microfinance clients, meaning that these are people that are impoverished. 63% of impoverished people are going to the private facilities to have a baby because they know better. They know they're going to get better. Not overly recent, but 2015, fantastic study from out of Chile shows that over 16 million medical records were analyzed of Chilean doctors that work both in the public facilities, because they have to. You're probably familiar with some of those models in Latin America, and also the private facilities because they want to make money and they want to do something on the side. It turns out with the same types of patients at the private facilities and the public facilities, the doctors do better. The outcomes are better at the private facilities. You ready for this? Economists, help me out. It's called incentives. If they do well with the patients come back to the private facilities, they make more money. At the public facility, there's no incentives to keep quality high. Wow. Wow. All right, so what else we found? We expanded what's called Medicaid in the United States as a result of the PPA, ACA, PPA, the PPACA, excuse me, and also called Obamacare. And what we found is basically that we spent billions of dollars and that there was no substantial outcomes of health for the people that received it. And that's been followed up in a couple other studies. Brookings Institute did studies on public health care costs. They found out that it's not free. Did anybody ever really think it was free? That actually it's about 4 times higher because of all the administrative costs when you build it in. Healthcare, public health care is unsustainable. We see this is projections in the US. We talked about that a little bit yesterday. Here's the graphic that Jacek was talking about earlier, which shows if you look that healthcare costs are up here, and they've gone up substantially greater than every other thing because of healthcare inflation caused by government intervention and regulations. Also, this is some great work that Mark Perry from the University of Michigan does on cosmetic surgery cost. He's compared them against the cost of inflation in healthcare. It turns out that in consumer-driven markets like cosmetic surgery, healthcare costs have not gone up as much. Wow. Like, we didn't know that. All right, so some lies that you're going to hear, and I'm trying to get to the stuff that you guys want to hear about real quickly, but this is good stuff, okay? So you're going to hear bad things about the United States, particularly those of you from Europe, those of you in Latin America. Oh, the United States, people die in the street and stuff like that. It doesn't happen. There's a bunch of numbers to show that it isn't. First of all, if you're from Europe, what's the size of your house? And let's use, sorry, my meter's estimate's going to be bad, but square feet approximately. Any guesses? Yeah, it's even less than that. So, right, average square foot of a house in Europe. Come on, my Poles, you can tell me, right? It's small, right? You want to know what the average size of a house is in the United States? And this is not just Texas. This is all across the United States, right? Yeah, it's like over 2,000 square feet. So we got about 3 times the house size. How many Europeans own multiple cars? How many Americans have multiple cars? How many Europeans have multiple gaming consoles in their living room? How many Americans do? How many Americans have multiple TVs? How many Europeans do? Have you looked at the size of a refrigerator in the United States compared to the size of a refrigerator in Germany or something like that? So if you look at the total cost of living and you compare that to healthcare costs, it turns out that American healthcare, and this is actually a study done by a researcher that goes by the name of critical analysis, the random critical analysis, does some great work and showed that there really isn't that much difference. The US costs are a little on the high end, but compared to cost of living, like this, Americans eat out more than Europeans. Did you know that? Americans buy more Starbucks than Europeans. So yes, our healthcare costs are higher. It's because we have a much higher, if you will, cost of living. A lot of that's behavioral. All right, so total out-of-pocket expenses in the United States. Oh, everybody's like $20,000 a year. It's $1,000. $1,000 a year in the United States. People spend on average, how much do you think on a year an average millennial spends on tattoos, right? Okay, how much do you think on a year an average millennial spends on Starbucks coffee? How much on so $1,000 for an entire year? Okay, yeah, you would think it would be more. All right, another big problem is people will say, oh, in the United States, the healthcare outcomes are horrible. Well, no, that's been debunked as well. For example, automotive accidents. How often do Europeans drive like 100 miles to get to work? I do. Every day I go to work, which is not that often. But I live up in the country. I live in the suburbs, okay? It just doesn't happen. You look at the average miles driven by an American, which is, I think it's up to what, 15,000 miles now per year? It's way more. So it turns out young people, one of the largest forms of death in the United States for young people is car accidents. Do you think that's the case in England? No, it isn't. And by the way, what happens to population statistics like life expectancy when young people die? Does that drag down the number more than if an older person dies? So it turns out a person from, I think it was Michigan State or University of Illinois, something like that, did a study, took out or normalized car accidents in population statistics. Guess where American life expectancy goes to? To the top of the pack. Turns out we have fantastic life expectancy, just like everywhere else in the world. We just think we don't because we're told we don't, but it's actually due to things like automotive accidents due to our lifestyle. So how many large developed nations that you hear about all the time, like Switzerland or Japan or England, that have these great public healthcare systems, how many of them share hundreds of miles of a border with a developing nation and have millions? Did you hear we had 250,000 people cross the border in the United States last month? Does that happen in Japan? Does that happen in England? Does that happen? I don't think so. Okay, so does that affect population health statistics? Yes, it does. Just what it is. Social determinants of health. Here's where I get to bash Americans a little bit. Okay, everybody else that's not Americans, are Americans a little heavy? Yeah, okay, yeah, fattest nation, well, second fattest. I think actually, believe it or not, actually Mexico, I think, has a higher rate of obesity than the United States, but the United States is number 2. So guess what? Does that affect health outcomes? Yes. All right. So last part, and then we'll get to the good stuff. You ready? So Elizabeth Warren, who's a senator in the United States, wrote some research on medical bankruptcy that you see all over the internet. It's lies. It's wrong. It was bad research. It's been debunked in things like Health Affairs. So here's the deal. She said to people that had debt, including medical debt, it turns out people that have medical debt also have things like house debt, car debt, gambling debt, credit card debt. It turns out that this is not their only debt they have. Surprise, right? Well, guess what? They asked them, hey, what caused you to go into bankruptcy? And they said, oh, it wasn't my really expensive car, it wasn't my really expensive house, it wasn't my credit card debt, it was health, because I can't be held responsible for that, right? You know, yeah, I got a really nice car, but I can't be held responsible for the health debt, right? So people gave as their response why they went into bankruptcy. So the researchers decide, hey, you know what? We got this country right north of us called Canada that actually, they supposedly have free health care, right? Let's compare our bankruptcy rates. Turns out Canada's bankruptcy rates are higher. Wait a minute, they don't have health bankruptcy, but yet their total bankruptcy rates are higher? So guess what? It's not what you think it is, right? So you're gonna hear good stories about it, but it's not really true. All right, so other things you've heard, socialist healthcare utopia that is Cuba, yeah, not so much. Anybody that's been there knows that there's a 2-tiered system. There's the good hospitals that they send the Cuban officials to, and the international visitors. I actually got to go to Cuba about 4 years ago when the US was trying to nationalize relations, and they showed me the good facility, right? And then I started talking to people, and this is the actual facility that the Cubans go to, most Cubans. So Canada, wait times, look at this. If you're over 65 years old, you have to, over 60% of them have to wait at least 4 weeks before they can see a doctor. The United States, about 21%. So free markets have some advantages. Sweden, turns out that more and more Swedes are getting private health insurance because they want to go to private facilities and they want better care. So they don't like the public facilities. All right, so what do we know about medical tourism, particularly medical tourism in Colombia? And there's some great numbers here. So it turns out Colombia is one of the rare countries in the world where, compared to the United States, they have more Americans coming to Colombia than they have Colombians going to the United States. There's only a few countries in the world where that's the case. Most of them are medical tourism related. Mexico, of course, being the biggest. This is all of Latin America. And then the next one is Colombia. Congratulations. One of the top nations in the world for getting people from a really good country with good health care to come to your country and spend good money here. So in terms of the total growth rate about 12%, I know that's hard to see, of all countries where Americans go to, and this is from the Bureau of Economic Analysis, part of the Department of Department of Commerce, there's what I was looking for. It's a higher growth rate than what you would see from most countries. And here it is all together, and I'm gonna blow it up for you here in a second. This is Colombia, this is Mexico. Mexico's getting, at least based on this sample survey from the Bureau of Economic Analysis, about $250,000 minimum. We know it's more, because there's a lot of stuff that doesn't come up in the sample. But Colombia is right next to that, and here you go, you get to see it big. So Colombia is about $50 million minimum from the United States alone, and it's growing at about the same rate as Mexico. You guys are beating Costa Rica. You guys are beating India. You guys are beating the Dominican Republic. Canada isn't even close, right? You're beating Korea. You're beating Thailand. You guys are doing great. All right, so what does that mean? That means a lot of people are coming for things, this was like cosmetic surgery reported on Real Self. They have a mommy makeover site where people self-report on the procedures that they're doing. And I looked at some of the numbers, both pre-pandemic and post-pandemic, and it appears that Colombia, along with many other countries of the world, will be back to normal at the earliest, say around October, November, in terms of people traveling for healthcare. I know Delta variant, that could throw a wrench in things. At the worst, based on this trend line, we're looking at sometime in 2022, and you'll be back to having a lot of American dollars coming to Colombia. So using those numbers very quickly, I apologize, I'm running out of time. I want to get to the good stuff. So took Colombian medical tourism numbers, which is this number at the top, along with a variety of other numbers to look and see if free market healthcare is having an impact in Colombia other than just making money. That's good, but let's see if there's even better. And so I looked at some Colombian statistics on things like hospital beds, mortality rates, infant mortality, how many doctors are seeing, and also the UN's social or sustainable development goals and the healthcare area. And it contains some social justice things, but it also contains some things that you would consider civil liberties and some general healthcare statistics. Here's what I found, and all the stuff you want is right over here. So it turns out medical tourism in Colombia is very positively correlated with total number of private hospital beds as well as beds per 1,000 residents. It's also negatively rated with mortality, that's good. Deaths minus external factors like accidents, meaning stuff that is probably more medically related. Infant mortality, really high correlation, 97.97. So what we're seeing is medical tourism appears to be correlated with good outcomes of healthcare in Colombia. Now it gets even better. So we look at the UN's sustainable development goals. They're healthcare related. There's a 0.91 correlation, meaning exactly what the UN is pushing, Colombia is doing it simply by improving their healthcare through free markets. This is mostly private hospitals, private facilities that are improving because they have incentives to prove to get more Americans to come here and to spend more money on hotels, on transportation, on food, on tourism, and on healthcare procedures. And that is leading to better outcomes not just for the Americans, but for all Colombians. Is this incredible? All right, so I wanted to see what is the primary driver. So I tried to figure out how to determine precedence. So what I did is I took the numbers that were happening in Colombia from a healthcare standpoint and shifted them over essentially a year and looked at the medical tourism result the next year. In other words, I was saying, is there a correlation between stuff that happened last year and stuff that happens next year? And here's what I came up with, a pretty easy statistic. My last thing is the only one that was really good correlation is a positive correlation between GDP. Now this is pretty cool stuff. You ready for this? If the economy grows, typically there's going to be more capital available. If that capital is put into, you ready for this? Healthcare, more people come to Colombia for healthcare, Colombians get better outcomes. That's my thesis. That's what I'm going with. I'll skip the rest of the stuff except the last slide. And I'm so sorry, I know we're running a little bit late, so it's just saying. All right, so here's the thing. You ready? One of the things you can do to help spread the liberty movement is get more people in the liberty movement to be rich. I want you all to be stinking rich so that you can then do things with your money so that you can improve liberty for everybody. So up to you, though. It's your choice. So here's the thing to do. Invest in healthcare. Healthcare is growing all over the world. It is the, if you will, the closest thing to a sure bet in the world. The things that really need to happen, because there's a severe lack of this around the world, is new healthcare facilities, training for healthcare providers, particularly clinical training, and the last thing is healthcare management. There's a severe lack of people that understand healthcare and understand management of healthcare facilities. If you stick every single dollar you can come up with into something healthcare related, technology in healthcare, the idea of non-traditional types of healthcare, alternative healthcare, what we call in the US is direct primary care, corporate healthcare, not corporate healthcare in terms of hospital, but corporate healthcare in terms of bundled contracts between corporations and healthcare communities. Take advantage of the upcoming millennial apocalypse. It's suggested that millennials in most developed countries, about 7 in 10 of them will be obese by the time they're middle-aged. That's going to lead to a lot of healthcare needs in the future. Invest in healthcare, become incredibly rich, and then support the liberty movement. And with that, I'll end. And I'm so sorry I went over a little bit. Thank you. I can stay for the break for questions or ask questions, up to you.
But it's okay if we don't do the questions with the middle behind.
Yeah, no, we can do. Hey.
So I have a bunch of questions. I love it. But I also want to invite you, those who want to take a small food, bring a snack, the cute snack. You can do it, you can go outside and bring it inside so we keep this rolling and we can have time for the questions. So we have 1, 2, and 3. Let's start. 1, 2, 3, 4. Let's start.
I'll answer all of them. I'll be here as long as you want me to. Yes, please.
A fantastic presentation.
Thank you, thank you.
Actually, I don't have a question. I need you to be here for my talk on Sunday, which is about immortality.
I'm there.
But not because of me. It's because I invited the former mayor of Medellin,
Wonderful.
the former governor of Antioquia, and candidate for president of Colombia. And we need to tell him this because this is the campaign to be president of Colombia.
Yeah.
So this is very important. Everybody here is welcome if you want to be the future president of Colombia if we win.
Yeah.
I am the future president of Colombia, a libertarian.
Please. Yes, Chris.
So I understand the obvious free market medical ecosystem, but in my town, in Grand Rapids, Michigan, we have something called the medical mile, miracle mile, or whatever we're calling it.
Yep.
Every town is bragging that the medical sector is innovating, growing.
Yes.
And I think it's fake, right? Because that isn't medical tourism that's understandable with free markets, it's government churn.
Yeah.
And so help me to understand how you're so optimistic when much of the medical system in my mind, is really revolving government money.
So the best aspect that I can see is the growth in alternative models that don't involve a government payer or a government facility. That's going to be our savior, because if we can stay as far away from VA, Medicaid, Medicare, if we can stay away from public facilities, public or even hospitals pumped up with federal dollars, things of that nature, there's so many wonderful underlying trends in healthcare, including things around alternative medicine. And I'm talking about like supplements. One of the best things you can do for yourself during a respiratory illness, for example, like COVID, is get enough zinc, is to get enough vitamin D, is to exercise so that you're not obese, which is the comorbidities with COVID. So those are things that are typically happening outside of government oversight. The growth of doctor-run facilities like direct primary care is, oh, it's so wonderful. It's an amazing use. These bundled contracts, all of these bundled contracts are above or below, if you, whichever way you think, below government oversight, under government oversight. They occur with very little government oversight. So that's where my optimism comes from. So obviously all the other trends that you look at are more public, and there seems to be a lot of bad things going on, particularly around Medicare, Medicaid, and I don't know how we get rid of those things, but I do know that most of the good news is all free market. Does that kind of answer your question a little bit?
David, so many fascinating facts and sound bites
Thank you.
in this talk. Thank you for this.
You're very welcome.
A phrase I use, and all of us use, which I think is very dangerous, is healthcare system. It suggests that the system is somehow controllable from the top down. It's not. There are so many millions of moving parts of people self-organizing. So I always use the phrase, or try to use the phrase, healthcare ecosystem.
That's a good point.
If we all started to use that phrase, it would advance our movement just a tiny bit.
I agree. Dr. Singer and I were having this wonderful discussion about Kaiser, which has more of an integrated system. In other words, they offer both clinical care and they offer, payer services, and they work with employers. Just like we don't think about Walmart and the back office functions of Walmart, the logistics, the supply chains, things of that nature, I think there's some relevance to the idea of the system, but I completely understand what you're saying. It's too simple, and it confuses people, particularly that aren't knowledgeable about business.
Walmart and other things that appear like a top-down system consist of millions of individual service providers,
yes, agreed.
Technology providers,
absolutely,
and so forth that comprise an ecosystem that's
yes.
self-organizing.
Yep,
thanks.
That's exactly right. That's a good point.
Fantastic presentation. Just a quick question, more like from the region, right? Like,
yes.
Market-driven solutions or alternatives have you seen to provide healthcare for like what's so-called the bottom of the pyramid?
Oh, wonderful. Thank you. So first of all, excellent question. The Aravind eye system, there's a YouTube video by a professor from Harvard in Harvard Business School, and he talks about that along with the color. And the title of the YouTube is The Bottom of the Pyramid. And he talks about this, and he mentions this free market solution that was developed along with a couple others in other countries. But this is a free market healthcare solution. So here's another one. You ready for this? We've been trying to push in the United States to get away from some of these government programs, both for school districts, for state employees, for retirees, pensioners, Medicare, Medicaid, to get to things like DPC practices, where instead, kind of like a school voucher, which you heard from the previous panel, is give people back their money and allow them to have choices. They actually could get better quality care and more frequent care and a better consultation from their physician, because their physician works for them if they were to go with direct primary care, which is a model that's being used in the United States quite a bit. We're also seeing value-based healthcare systems, not necessarily just in the government use of that, but the idea of there are software companies, I'm actually consulting with one right now, that is getting ready to introduce a value-based equation that says, hey, based on outcomes that we're able to get from data and based on the price, here's the best place for you for your specific procedure. This is going to come from the tech industry. This is going to come from entrepreneurs. This is going to come from people that really care about you because you're consumers. And they're going to give you these wonderful options where you can choose to go to the place that you need. So those are the things that are going to help people. And if you think about people at the bottom of the pyramid, even in India, most people have cell phones. When they can get to a point where they can access a doctor via telemed because it's cheaper, when they can find out where they can go to get a cheaper procedure that's also high quality, that is truly serving the base of the pyramid. Just like Uber and Lyft reducing drunk driving accidents, these technologies are going to improve life, not just for the wealthy, but for everyone. I think so. But you have to be an entrepreneur. Pick up the sword of entrepreneurship and go cleave and create cool new things.
Thank you for the talk.
Sorry.
Yeah. I think it was very interesting to know that this term medical tourism existed even before the pandemic, because I barely know the term because of the vaccine. But I thought it was, I wanted to ask you, how do you think this medical tourism industry will evolve after the pandemic?
Oh, excellent. So every number that we've been looking at shows that because of pent-up demand, there's some numbers from England that show that potentially 60% of people that have cancer or precancerous tumors were not getting treatment during the pandemic. This is horrifying. There's going to be so much pent-up demand, and we're seeing, particularly in mental health, alternative health, other types of trends, that there's going to be, particularly among millennials, they're okay with traveling for healthcare. I expect medical tourism is going to grow at a faster rate than ever before. So tell me, you're a young person, would you travel for healthcare? If you had cancer, would you travel somewhere?
Probably not.
Probably not. Would you take your mother to the best place on the planet if you found out where that was, and would you help her to go there?
Yes.
If it was in India, would you go with her?
Yes.
Okay. I think that's the answer. I think consumerism gives us choices, and when we have those choices, I think we're going to take advantage of them.
Two things. The first is like an anecdote.
Yeah, please.
I am from Costa Rica, and something that is really laughable to me is that right now we have a huge amount of expats, American expats.
Yes.
But a big percentage of these expats are low income.
Yes.
American expats.
Correct.
Go from Costa Rica, from the U.S. to Costa Rica because of the promise of getting free health care. And they are straining the system that was already strained.
Yes.
So I think that's laughable.
But here's the thing. So a lot of those dollars may go to private facilities, not just the public facilities, because again, in Costa Rica, can a middle class or even perhaps lower middle class American that can afford to go to Costa Rica, and by the way, Costa Rica used to be inexpensive, it's not so inexpensive anymore for American expats. It's become, it's not as cheap as Belize, for example, right? So can an American afford a doctor's appointment in Costa Rica? And the answer is yes.
Oh yeah.
Yes.
And at the end of the day, what we Costa Ricans do is we have to pay for the social care.
Agreed. But
but at the same time, we have, because it is very badly, I mean, we have to pay also for the private care.
Yep. I think the money going in will lead to more private care and more opportunities in Costa Rica. And I suspect I have the same data for Colombia that I have it for Costa Rica. I just haven't run the numbers. I think I'm going to find that Costa Ricans are healthier, they're better off than ever before because Americans are pumping money into the Costa Rican economy.
Absolutely. Now, the last question, I mean, the question I have, short, is that even though it's getting better, and there is a reason that we have medical tourism, there are issues like malpractice, even deaths.
Yep.
So then that makes me think we need, or maybe there is, market solutions to deal with those things.
Amen. That's what I'm asking you to do. That's exactly right.
I want to talk about that with you, yeah.
Yes. So, and here's an interesting thing, and Dr. Singer and I were just talking about this. So there is only limited data, comparative data, to show what the potential health outcome differences are between countries in the United States, between Germany and Egypt and places like that. We don't know, but some of the data that we do have show that the differences are not as great as you would think. So a good surgeon in Costa Rica is probably not that different than a good surgeon in the United States. We don't have all the empirical data to support that hypothesis yet, but we do have inferences that suggest that it's probably not that different. And so the fascinating thing is there's probably, there are slight differences, but not broad differences. Interesting, huh? But we need to track that. We do need to track that. Anybody else?
Yeah, so we're ready.
Okay, thank you very much.
Thank you, thank you, thank you. Oh, you're very welcome.
Very, 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 very,
And I'm